I don't want to extract bicuspids because I know that it's going to crowd their upper arch and it's going to crowd it's going to crowd the tongue because the tongue isn't getting smaller unless you're going to go in and do tongue surgery on somebody. You're going to be making a smaller box and trying to stuff this big pillow in there, and it ain't going to fit. It's got to go somewhere. It's going to go back into the throat and shut off the airway. Most of the people I have that have jaw joint problems or sleep problems are bicuspid extraction, retruded chins, and things like that. And I just look at that going, I don't want that to happen to patients I treat. I want to be, hopefully help them, not lead them down a bad path, but actually hopefully push them, to a more healthy lifestyle later in life. They may not know now, but maybe later on they may never understand it, but at least I can go to bed at night sleeping better, thinking that I'm doing what's right for these people, not what's wrong for these people. I do talk to a lot of parents about when I see airway issues with their kids that they think it's kind of goofy that their dentist is looking at and talking about you need to get your child to an ear, nose, and throat doctor, have their adenoids or tonsils looked at or allergy testing going on and I tried to explain to them about the low tongue posture and how that is causing the orthodontic problem, and we got to get that cleared out or it's going to be worse. And if we can get the airway cleared up and get proper tongue posture, I guess, we're going to hopefully prevent severe orthodontic problems, or we can intercept them at a young age. BioBlock, by expanding the upper arch and then driving it forward and then bringing that lower jaw forward, you're bringing that tongue, you're making a bigger box to stuff that pillow in. You're getting the bigger box stuff in it so that pillow has more room to be where it's supposed to be. Instead of back in the throat, it's supposed to sit, roof of the mouth and forward. What I want for every child comes into my office is to help them develop, or hopefully they will grow in and have healthy jaw joints, a good profile, and a good airway. In contrast to what I see coming into my practice now as adults, a long face, recessed chin, and jaw joint problems.